Now, this isn't just an issue for the poor. Any one of you who has an aging parent or a sick family member knows exactly what I'm talking about. So that was my light bulb moment. And believe me, once you get that beam of recognition, you can't help but to see the connections everywhere you look. So think for a moment about our workplace culture and our convention culture, which causes us to sit for way too long. What if we made our workday a little healthier by making the automatic things that we do just a little harder? Like creating incentives to park further away from the door, or taking the stairs, or holding walking or standing meetings. And then consider those neighborhoods where moms don't dare let their kids go outside and play. What if we created human school buses like they've done in Kingston, New York, where kids walk together as a group, supervised and protected by adults, and all the while increasing their physical activity? And what about the healthcare providers who are doing the right thing by asking their patients about their lives outside of the clinic, but then just don't know how to connect them to the services that they need in the community? There was a survey in 2011 that showed that 85% of doctors believe that unmet social needs like having access to healthy food or reliable transportation and adequate housing are directly linked to health outcomes. And yet, 4 out of 5 of these physicians did not feel they could confidently meet the needs of their patients and improve their care. So why can't we have pediatricians write prescriptions for The Cat in the Hat, or any other great book to read out loud to kids, or have prescriptions to get kids off the sofa, jumping rope or playing Foursquare, anything that'll get them active for an hour a day? When the light bulb clicks, you see how deeply intertwined all of these different forces are, and we understand what a prophetic role they can play in our nation's health. You know, there's an African proverb that teaches the wise aim at boundaries beyond the present. So let me voice the Robert Wood Johnson Foundation's idea right here and right now, that we as a nation will strive together to build a culture of health, enabling all in our diverse society to lead healthier lives now and for generations to come. But the truth is that even though we're the nation's largest philanthropy devoted to health, we don't make policy. We don't sell anything, and we don't deliver any healthcare services. The only power that we have is to bring together people with great ideas and people with great commitment and drive to create a new standard of health for all of our communities. And I think that's what we're starting to do right here this afternoon. That's what it's going to take to make a culture of health happen. Not me standing up here and talking about it, but you and others embracing the idea, studying solutions, sharing your findings, and then cranking up the volume on a nationwide call for change. So I'm looking forward to hearing the new ideas that our panelists are going to tell us about later. But I'll get you started by sharing some of the areas that the Robert Wood Johnson Foundation is going to work on, because we believe they're vital to achieving a culture of health. Now, 7 years ago, we committed $500 million to reversing the epidemic of childhood obesity. And the good news is we're starting to see signs of progress. Nationally, that relentless rise has started to level off, and among our youngest children, we're starting to see declines. But the progress is fragile, and we know that we have to keep pressing that accelerator at full pace. We also want to make sure that everyone who's eligible for health insurance has the opportunity to enroll, and make sure that they know how to get the most out of their insurance. We want to help people reach and get the highest value for their healthcare dollars, whether they're getting healthy or staying healthy. And we want to magnify the healthy places and practices that are happening all around the country. It's clear we have to address early childhood trauma, the roots of violence, and health equity. And like Shariki, we want to encourage businesses to take a lead in investing in the well-being of communities that they serve. Now, let me share some of the convictions of our foundation that have led us to face these issues. First, we will never be a healthy nation if we continue to be a violent one. So the foundation's aim is to focus on the causes and long-term ramifications of violence, how adverse childhood experiences can lead to toxic stress and can lead to violence later in life. We also believe that we will never achieve a culture of health if, through no fault of their own, some Americans are faced with much greater barriers to health than others. It's clear that personal responsibility is key to a culture of health, but there's no question in my mind that when nearly 1 in 5 Americans lives in neighborhoods that have limited job opportunities, low quality housing, unhealthy food opportunities, the deck is stacked against them. And health equity is a key issue for us for that reason. Now, I know addressing all of these issues is not going to be easy. In fact, we will never build a comprehensive culture of health if we just continue to tinker around the edges. We have to have a seismic shift in the way we deal with health, and it has to come from the ground up. And so that's why I'm here, because I know you aren't about tinkering around the edges. You're about being bold, you're about drawing new maps, and we need to change how we have expectations in this country, and we have to recalibrate our behavior as individuals if we're going to achieve a culture of health. So why do I think a change of this magnitude is possible? Well, simply because it's happened before. And every time it's happened, it started with a single good idea. So think back to 1970, the year that Earth Day was established. The word recycling wasn't even part of our common vocabulary, much less our daily activity. But people began asking, why are we choking our land and seas with paper and glass and plastic that could be collected and repurposed? And then they insisted on a change. And today, we automatically separate paper and plastic and glass because we've made it easy. We've made recycling the default. There are recycling containers everywhere you go, on sidewalks, in stores, in hotel rooms, in offices. In fact, most of us, I bet, feel guilty if you accidentally drop, the coffee grounds in the same container with the cans or bottles. And if you, like me, you quickly turn and fish it out, right? Yeah. Another shift happened when 911 came into being. Now, some of us can remember back when there was no single number that we could call in an emergency, and patients didn't get first aid before they got to the hospital, and when they were wheeled into the emergency room, the doctors and nurses didn't know they were coming. But all of that changed when someone came up with the idea of creating a single universal number and a system for connecting the first responders to the people at the hospital. Simple idea, revolutionary change. And now every child in America knows how to dial 911 as soon as they get infatuated with the cell phone, which they do get in about 3 or 2 maybe. Some places they even text it. So my question to you is, why can't we make building a culture of health our next national shift? Let's make being healthy the default so that one day kids will look back with the same disbelief that they have when they say, is it true that people used to really smoke cigarettes in hospitals? I think the famous science fiction writer William Gibson had it right when he said, the future is here, it's just not evenly distributed. And I think that's true when it comes to a culture of health. in a growing number of communities all across the country, people eager to connect ideas and turn it into action are demonstrating what is really possible. And many of you know these people. I'm sure you've heard about Rebecca Ani. She's established a program called Health Leads that allows providers to write prescriptions for food in the same way that they prescribe medication. And then college students help fill those prescriptions. The program is so successful that last May it was adopted by Kaiser Permanente. And Rebecca's not the only one. In Boston, the city has been partnering with a bike share program called Prescribe a Bike, where they can actually prescribe a bike for as little as $5 a day. And all across the country, we see doctors who are writing park prescriptions. You know, these are prescriptions that actually tell people where the nearest park is to their home and gives them a list of the activities that they can engage in. Now, let me tell you about Reverend Michael Miner. He leads a congregation in Hernando, Mississippi. And not long ago, he had the crazy idea that he would ban fried chicken from the church suppers. Because, yeah, he was tired of conducting funerals for people who had avoidable diseases. Now, we've spent a few days down here indulging in some fried food, and so you can imagine how unpopular the good Reverend's idea was. But he was committed to leading his flock down a new path. And today, not only do they have healthy potluck dinners, but there's a walking trail around the church and blood pressure monitoring in the lobby. And what's more, Reverend Miner has developed a curriculum to help other churches that want to start a health or wellness ministry. And the American Heart Association has adopted it.